Community Services. And we're live streaming. We're live streaming. All right, good afternoon and welcome to our Electronic Community Services Committee meeting on April 12th, 2022. Due to the COVID-19 pandemic, committee members are practicing physical distancing and are participating electronically. Councillor Galloway and I are present at the region, although in different rooms. And Chair Redmond and Councillors Lorenz and Nowak have sent their regrets. I'm going to ask Julie Hale to conduct roll call.
Councillor Verbanabek. Councillor Jaworski.
Here.
Councillor Clark.
Here.
Councillor Jowett.
Here.
Councillor Erb.
Here.
Councillor Kiefer.
Here.
Councillor McGarry.
Present.
Councillor Armstrong.
Here.
Councillor Harris. Councillor Shantz. Councillor Strickland. Councillor Foxton.
Delightful to be here.
And Councillor Galloway.
Present.
We have regrets from Regional Chair Redmond, Councillor Lorenz, and Councillor Nowak.
Okay, thank you. I would like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? And I see none on my limited screen. We have several staff presentations and we're going to lose our staff. So I am going to ask item 9.1 to present now, and then we'll go on to the consent agenda. So while we still have people to do that.
Thank you.
9.1 being the climate change and health vulnerability assessment launch.
Thank you, Chair Clark. I'd like to ask Director Sandy Stevens to introduce the report and presentation, as well as introduce Dr. Chris Busey. Thank you.
Thank you, Dr. Wong. And thank you, Madam Chair, and good afternoon, everybody. Yes, we're here to, at long last, finally present the Joint Climate Change and Health Vulnerability Assessment report that the Region of Waterloo partnered with Wellington Dufferin Guelph Public Health to create. So in 2019, our two health units jointly applied for and received $300,000 of funding from Health Canada through their Health Adapt program to conduct the climate change and health vulnerability assessment over a 3-year period. So Health Canada, through their Health Adapt program, awarded $3.6 million in grant funding to 10 projects across the country to support local climate change and health projects and initiatives. And we were fortunate enough to be one of those 10 projects. So the funding was used to hire ICLEI Canada, a consulting firm, along with Dr. Chris Busey from the University of British Columbia, who's presenting with me today, and is one of Canada's foremost climate change and health equity researchers. Together, they led the climate change and health vulnerability assessment for our two health units. But I have to also acknowledge Brandy Beavis and Chris Komorowski, two public health staff who are with us today and available to answer any questions if Dr. Busey's unable to address the more procedural ones from the region. But they were also instrumental in keeping this going, particularly through COVID. Without Brandy in particular, this wouldn't have looked nearly as nice as it does. So Dr. Busey, I'll turn it over to you and you can continue. Thank you.
Thanks so much, Sandy, and good afternoon, Chair and Councillors. Thanks so much for having me today. Before I begin, I do want to acknowledge that I'm calling in from the traditional and unceded territory of Syilx Okanagan Nation and to pay my respects to their elders, past, present, and future. I also want to begin by just saying what a privilege it's been to work with both ICLEI Canada and both health units, Wellington Dufferin Guelph Public Health and the Region of Waterloo Public Health and Emergency Services, to support this assessment process. I don't have a lot of time today, so my remarks are going to be rather high level. But I want to begin by noting that the assessment procedure that we went through for this project, our climate change and health vulnerability assessments, they're really a tool to increase an understanding of who is more and less vulnerable to the health impacts of climate change in a given geographic area. And they're done by collecting and synthesizing large amounts of data and information. And they can really be used to both build awareness in the community for impending health risks, as well as present health risks of climate change, and really kind of set an agenda moving forward for what we can do to identify suitable risk mitigation activities, programs, and interventions. So our assessment focused on climate change and health impacts related to 7 discrete areas: extreme temperatures, ultraviolet radiation, extreme weather, food and waterborne illness, air pollution, vector-borne and zoonotic diseases, and mental health impacts, all of which were related to climate change. And each chapter report actually presents a variety of information, relevant climate change projections, baseline health impacts of relevance to each topical chapter, population level vulnerabilities, and examples of existing adaptive actions that are already underway across the region. So those being programs, initiatives, and indeed policies. The main report, we're really delighted to announce, is now posted to the public health website. You can track down this information using the web link on this slide. This main report was a massive undertaking of information synthesis and original data analysis. The full report comprises more than 250 pages, and to translate the large collection of evidence that we pulled together for this assessment, we've actually created standalone topic-specific chapters, each of which include a really high-level executive summary for decision makers. We've also produced a climate science report to support the assessment, an 8-page highlight report that just went live today, which is a really good, concise bundling of the entire thrust of the assessment. And we're still working on a variety of different infographics that can be shared on social media and other mediums, which are forthcoming, but you'll be able to find all that information on the web link on this slide. So basically, when it comes to climate change, both now and into the future for the region of Waterloo, we know that local weather is expected to follow the 3 Ws. It's expected to become warmer, wetter, and wilder. And these changes all pose risks to human health and well-being across the Waterloo region. So in terms of temperature, we know that the mean, minimum, and maximum temperatures are all expected to increase across all seasons across the region and become more problematic, especially in the summer, where we're expecting to see much longer and prolonged extreme heat events. And this is going to, it's expected that this is going to differentially impact urban areas in the region of Waterloo, primarily due to the urban heat island effect, where surface level temperatures can be 15 degrees hotter, 15 degrees Celsius hotter than areas without natural land cover, and air temperatures about 1 to 3 degrees warmer in urban areas relative to rural ones. In terms of precipitation and extreme weather, we also know that we're going to see an increase in average seasonal rainfall, especially in the winter and spring. We're going to see more rain replacing snow, and certainly a decrease in precipitation in the summer and the fall. What we can expect is that that increase in precipitation and heavy rainfall events will likely increase the risk of localized flooding across the study region. And this is particularly true in winter months where rain on snow events can cause freshets, create slippery conditions, as well as lead to flash freezing events. So we know based on this overall seasonal trend of warming that we can also anticipate an increase in the number of freezing rain events, particularly in December, January, and February, where temperatures will be hovering around freezing, leading to more wet precipitation falling and then freezing overnight. Now, the main thrust of the report was really oriented towards identifying vulnerable populations. And within the kind of literature on climate change and health, vulnerability is really a function of 3 things. The first being differential exposure to a particular climate-related hazard, the physiological sensitivity of different population groups, and people's ability or population's ability to adapt to those changing circumstances. And what we do in each of these chapters is outline these 3 categories according to each threat posed by climate change to conceptualize the overall degree of population health risk across the region. And generally speaking, what we find, and granted there's some variation in terms of who's more vulnerable to which climate change impact, but populations most vulnerable to a variety of different climate impacts include seniors, primarily those who are living alone, children and infants, individuals with pre-existing chronic disease, namely folks who already have pre-existing respiratory or cardiovascular disease or mobility restrictions, people who lack material resources to adapt, so folks who are either low income, housing insecure, or homeless, as well as new immigrants, but especially those who speak neither French nor English, which might inhibit their ability to translate risk information communicated by the health authority into action. So the main synthesis report synthesizes a variety of available data. It depicts it in a variety of different mediums, including charts, geospatial figures, tables of key population characteristics to conceptualize vulnerability. So for example, on the left, you see the projected average number of days where temperature maximums are greater than 30 and 32 across the study region for both a baseline case as well as out to 2050 and 2080. And again, what this figure is communicating is that we're expecting it to worsen heat-related illness over time as a result of the increasing incidence of extreme heat events. On the right, we see a map that's actually projecting address density within the Grand River watershed 100-year floodplain. What this is actually demonstrating is the potential for risk in terms of contamination of water and impacts to local populations following extreme rainfall, and that these risks are greatest in particular for private wells and folks who have private wells across the study region, which we've also mapped in the context of this report. One of the most important aspects of this work is we undertook a rapid risk assessment to really quickly characterize which climate change impacts are going to, at present, play the most significant role in terms of impacting human health. And we've rerun that analysis again, looking out into the future out to 2050. And that's what this chart is showing you right now. And the results actually indicate that extreme heat was the highest ranked priority based on the measure of severity or the consequence, as well as the likelihood with which those impacts are expected to manifest across the region. So again, extreme heat, highest ranked priority now and into the future, and that's driven by broad population exposure to extreme heat, and consequentially the increased likelihood to disproportionately affect vulnerable populations that are outlined in that chapter. In terms of future risk, extreme heat was followed by health risks posed by poor air quality in the absence of suitable interventions, as well as risks posed by flooding. And the risk assessment also projects that while risks related to food and waterborne illness, Lyme disease, West Nile virus, and exotic zoonoses may be ranked as low to moderate risk at present, these risks are expected to increase both in terms of the likelihood and consequence into the future. So I just want to end by saying, this assessment puts the region of Waterloo Public Health and Emergency Services in a rather elite group of Canadian public health authorities. Less than about 20% of agencies across the country have actually conducted this type of assessment. And what I can say confidently is that your leadership in this space is going to lead the region to be better prepared to plan for and adapt to a variety of present and future climate impacts. It's going to also work to help to protect the populations across the region that are more vulnerable, again, due to those exposures, sensitivities, and adaptive capacities. Importantly, I also think it's worth mentioning that this work should not be seen as the end-all, be-all of the climate change and health portfolio, or indeed climate change work across the region, but rather as a first step. Importantly, you now have the data and information to begin taking action, designing programs and interventions in a climate-informed way, and certainly prioritizing responses that address the greatest likelihood and consequence events will both save lives now and into the future and reduce the burden on the healthcare system. So I want to certainly acknowledge and thank my colleagues. Again, it was a privilege to work with the Region of Waterloo Public Health and Emergency Services on this file, and myself and Brandy and Chris are more than happy to answer any questions that you might have for us.
Thank you very much. Colleagues, do we have any questions? Sorry, I don't see, I've lost all of you. There you are back. And I do not see any questions. So thank you for that. And we will move on to the next item on the agenda as quickly as we can before everyone disappears. That is the consent agenda items. Now, the staff have a number of presentations to come, and I'm told that each presentation will touch on some of the information in the consent items as well. So what I'm going to suggest is, if you have questions that will influence your ability to vote on the consent agenda, please ask them now. If you simply have questions for information or background but are comfortable voting, maybe hold off until after the staff's presentation. Okay. And I'm told we still do have our quorum, and Councillor Strickland is with us. So is there any request to remove any items from the consent agenda? Seeing none, we will now vote to approve the consent agenda items. I need a mover and a seconder. Moved by Councillor McGarry, seconded by Councillor Galloway. All in favor? And that is carried. Thank you. Okay, on to the regular agenda. We did just have item 9.1, so item 9.1.2, building better futures, creating new affordable housing through surplus regional lands. We do have a staff presentation, and I am going to call on Ryan Petitpierre and Matthew Chandy to introduce the report.
Thank you, Chair Clark, and the screens are just loading, the slides are just loading up now. Great. Good day, Chair Clark and Regional Council. We're very pleased to have some time with you this afternoon to present our work under the Building Better Futures framework. This presentation has been put together for the purposes of an update on work that we have accomplished to date, work that's currently in front of you on today's agenda in the form of recommendation reports and also work that we plan to accomplish over the remainder of the year. Sarah, if you could go to the next slide, please. And thank you. And all of this work, the decisions that we make, the reports that we draft, they're all grounded in this vision for Waterloo region. And it's in a vision that is admittedly ambitious, but we also know that delivering on it is vital in creating the community that we aspire to have here in the Waterloo region, one where everyone has a home that is both appropriate and affordable. That's where we've set the bar for this work, and we're pleased to be able to update on where we've been, where we are, and where we hope to go next. I'm going to turn it over to my colleague, Matthew Chandy, who's our Director of Economic Development and Smart Waterloo Region. Matthew?
Great, thank you very much, Ryan. And one of the things we wanted to do, and Sarah, if you could move to the next slide. Thank you. One of the things we wanted to do for council today, along with this update, is just do a recap of the team that we've put together to really help achieve our target of 2,500 units. It's a hybrid approach, something that we're doing differently here, really to bring all hands on deck. So it's really been coming together under a cross-divisional team between our housing team and our economic development team. And I should also say many other departments across the region are all stepping up to help achieve this target. And so I don't want to forget all the other departments that are also supporting. But on the core team, really what we're doing right now is focusing on opportunities to also expand how we can look at different ways of how we can achieve that 2,500 unit target. And so that really means looking at our lands differently, regionally owned lands differently, how we can accelerate bringing those to a state of development readiness. And so bringing on the capacity with new team members to help do that site preparation and that type of work. So now with having this hybrid cross-divisional team, we're really able to look at the development end of things, government programs, how we engage collectively. We also are able to really look at a portfolio of lands now. And so having team members dedicated to focusing on land availability and how we expedite bringing those lands to, again, a state of site readiness. So that is something that we're really trying to build our resources around. And hopefully our hope is that this team will be really able to, this dedicated team will be able to really push this agenda forward quickly. I'm going to turn it over now to Sarah and Ryan to get into the details of 2021 and our upcoming focus for 2022.
Thank you very much, Matthew. Turn to the next slide, please. Thank you, Sarah. As a quick recap, it's important to know the work that was accomplished in 2021, which has set the foundation for the 2022 projects and beyond. In 2021, the region approved a Building Better Futures framework with established targets, and our teams are developing the following action plans based on these key initiatives. It's the establishment of a $20 million fund to support building affordable housing units. This work is well underway and forms part of the 2022 and 2023 work plan. We have identified strategic investments in the Waterloo Region Housing Master Plan, Principal Plan. This plan provides a policy basis and action plan to deliver affordable housing, such as our 3 Waterloo Region housing projects underway. We have a clear leadership direction to advance surplus lands for affordable housing. Sarah will talk about these in greater detail. That will shape the 2022 work plan. The region has a unique source of funding through the regional tax levy. Again, plans are underway to use this funding this year and to move through with new affordable housing units. The region has and continues with its advocacy work to request greater funding for affordable housing and shelter accommodation programs. This includes recent input from the Provincial Housing Task Force, the Ontario Housing Summit, and discussions with provincial and federal governments for funding solutions and opportunities, such as the RHI funded projects. Next slide, please. In terms of a few other 2021 highlights, it's important to note that one project exemplifies the work of many of the projects that were completed in 2021. We're going to look at the project for the YW project at 1470 Block Line. This housing project supports the 4 guiding principles of the Building Better Futures framework. As a collaborative rapid housing project, this project has accelerated development of 41 units with 3 levels of government funding, plus lands donated by the City of Kitchener as an innovative land lease project. As part of a healthy, safe, and equitable community, this project provides new, affordable, and supportive housing for women. As an urban location and as a sustainable project, the YW project is located along the Ion LRT route and respects the global climate and environment as a net zero ready, achieved partly through electrification and mass structure technologies. As part of the Building Better Futures mandate, the region has helped support this project through the funding application and development charge contribution. This site is in the occupancy stage and has plans for a second stage. Next slide, please. 2021 was an active year. Just to touch upon a few other highlights, there have been 680 new homes created as part in a 1-year timeline. These projects are under review and under development. This includes supporting the first Indigenous-led affordable housing project, advancing a 28-unit housing project in the township of Woolwich as part of the rural housing objective. Last year, the region approved 100 members of priority communities through the Portable Rent Assistance Program. And last year was also the start of the lands prioritization strategy with action this year. Next slide, please. In terms of looking at the progress to date, the region provides a publicly available dashboard, and this shows the progress of the Building Better Futures housing projects. The dashboard provides a transparent look at where the region is at delivering its 2,500 affordable housing units. Today, there are 680 total new homes, with 619 projects in development. This also includes 61 units that have been occupied, recognizing there will be more being occupied later this year and beyond. There are 170 supportive housing units, making a difference to end homelessness. We recognize that it takes time to build these homes and to occupy these homes, but this dashboard shows the progress that's moving ahead. Keep your eye on this dashboard. Next slide, please. I'd like to turn over the presentation to Sarah.
Thank you, Ryan, and good afternoon, Chair Clark and members of council. I'm very happy to be here this afternoon. As our team pushes forward with a range of new housing initiatives, we are looking to build a deeper level of understanding on both our existing community housing stock, but also housing need within each community across the region. These next few slides will take a look at our affordable housing portfolio across the region through the use of heat maps. So a couple things to keep in mind as we're looking at these maps. We have delineated area municipal boundaries. We're showing the regional road network, and we're also highlighting the central transit corridor in purple. Now, the average number of housing units by location is shown in varying colors across the map. This first map here is a 2021 snapshot of the Waterloo region housing units across the region, being 2,814 in total. Building on that, this next map layers in our community housing portfolio in full. This map is reflective of all units transferred to the region as the service provider from the province in 2001. It reflects the roughly 9,232 units in total. And what's interesting here is you can see that there's an affordable housing unit focus around the transit infrastructure and also in the existing and established communities in our area municipalities. This next map layers in the good work through the Building Better Futures initiative. So you can see here in the black housing icons, those icons are reflective of the work completed in 2021 to bring 680 new affordable homes in development and occupied. This map also highlights the 3 surplus properties we're looking to bring forward this year. Now, on the surplus properties, there is one located in each of the 3 major cities in the region. The sites located in Kitchener and Waterloo are both vacant and already zoned high-density residential. The property in Cambridge is also vacant, but currently maintains its existing institutional zoning as it was a former school site. So that property will be subject to a zoning amendment prior to going to RFP. Now, initial concept work on these 3 sites shows that the region have an opportunity to bring forward roughly 119 new affordable housing units to the market through development of these properties. As part of the RFP work, our work program as a team is intense this year and looks to build off the lessons we learned through the Beechwood pilot last year. In that work, we'll be doing some technical background studies. We'll be completing community profiles to understand housing need in each of these areas. We'll be looking closer at financial incentives and building out a toolkit so there's clarity around what's possible from the development community. And we'll also be working with our area municipal partners and local elected officials to create an engagement plan that makes sure neighbors are informed and have the opportunity to learn both about the RFP process, but also the potential for development on each of these sites. So in addition to this work program, we're also looking to test a few new benchmarks through this RFP process. The first is the idea of piloting a land lease. And we're asking in the report in front of you today to pilot the land lease model on one of these 3 sites. Now, the land lease model is in the interest of looking at ways to extend the length of affordability on this site. Appreciating through Beechwood, we were able to achieve success through securing 25 years of affordability. We're looking to establish sort of a minimum of 40 years through the land lease process and potentially longer. The other benchmark we're looking at is setting a new baseline of 40% affordable housing units on any regional surplus property. In addition to the surplus lands, there's a number of initiatives underway with Building Better Futures. The first is partnership opportunities. Our team knows partnerships are going to be key to trying to hit the 2,500 unit target. And so we're active in trying to build partnerships with private sector, nonprofits, and area municipalities. We're leveraging funding opportunities with provincial and federal partners. And we're also trying to build innovation and learning into our everyday practice. So that means building out best practices in affordable housing, sharing lessons learned, and trying to create a space for new ideas and new players to come to the table. We appreciate this housing crisis is an all hands on deck situation, and we need to make sure there's space to have those conversations. We're also connecting regional lands and planning tools. And you heard that earlier today from our planning colleagues in the good work through the regional official plan. We're looking to make sure that we can connect housing need to every aspect of work that we're doing here at the region. So that's looking at workforce housing, that's looking at transit supportive housing, seniors housing, family-sized units, making sure there's housing options like exploring missing middle. We're building out policies and incentives to support these efforts. We're also building out a portfolio strategy, which Ryan touched on. We're looking to streamline processes, consider new alternatives for land ownership, and establish evaluation metrics to try and advance affordable housing more quickly. I'll turn it back to Ryan.
Thank you, Sarah. I'd like to highlight a few other initiatives that will be a focus of this year. When we look at a blueprint for affordability, we are advancing our Waterloo Region Housing Master Plan, our principal plan, and to work including supporting the 3 Waterloo Region housing projects at Kings Court in Waterloo, Wilson Avenue in Kitchener, and Langs in Cambridge. We'll also be preparing an update to the principal plan for continued housing opportunities, recognizing some additional innovation opportunities may exist this year and next year. In terms of incentives, our teams are working on an intra-municipal working group as part of the Housing and Homelessness Leads Committee, and will present a range of affordable housing recommendations to our various committees and councils for review and consideration. With rising cost of housing, these tools will become an increasing important part to reach our 2,500 unit goal. Each year, our teams advance solutions, services, and release valuable point-in-time information reports to end homelessness. As a policy action, our teams are active and involved with the regional official plan update to introduce new housing policies that will help reshape our community for years ahead with greater housing options and affordable housing opportunities. Next slide, please. As we close the presentation, we'd like to highlight the good work at 416 Kings Court Drive in Waterloo. This Waterloo Region housing site will add 73 new affordable housing units to an existing site located within walking distance to a light rail transit station and to a park space. As a leadership initiative, this project will provide at least 60% of the units as multi-bedroom units, increasing the opportunity for families to live in affordable housing options. As we receive funding updates, we hope to start construction later this summer. Slide, please. As a concluding note, these projects are making a difference. We'd like to note a personal story from one resident that showcases the importance of this work. With the help every month, it has put a smile on my face after a rough week of working hard to know that after paying bills, I'm not completely broke. It allows me to focus on my son and keep my eye on the goal of bettering my career and to eventually get to where I want to be without having to burden myself and my family in the process financially. We thank you for your time and look forward to any comments.
Thanks, Ryan and Sarah. That was excellent. And I do see some questions. Councillor Jaworski.
Thank you very much. And through the chair, I'm not sure who I'm really asking it to. It might be to Sarah, so I'll give her a heads up on that. When I think of land lease, which I haven't really much before, I would think you would want to lease land because you might want it back. But you actually twisted that around as it actually gives you more control over the current user to maintain affordability. So I just wanted to double check if my understanding was correct. By doing a land lease, we don't actually want like West Hill Drive to come back to us at any point in time. We want to maintain its affordability as an example.
Thank you. And through the chair, yes, Councillor, the intent of testing the land lease is really in the interest of extending the length of affordability. You're right, the land lease at the end of it could allow the region to take it back if we decided at that point in time. But typically with land lease, the term of the land lease is so long that it almost functions like a sale. So depending on the term that we land on, whether it be 40 years, 50 years, in some cases 99 years, it's really to test out that term of affordability.
Okay. Thank you very much, Sarah. And then not sure who this is for, but well, we really seem to have a cadence of projects on the go, and they become running in parallel. As was mentioned, Beechwood Drive, probably in process now for about 24 months. This now in process with 3 properties in the 3 urban centers. I just wonder, and this might be either to, well, I'm not sure who it's to, but when would we foresee like the next round of these? Like, are we going to be doing these in parallel every 18 months, identifying a set of properties, going through this process? Or is this sort of a whole bunch of one-offs that happen to be running at the same time? I just wonder if this is sort of a new process. So if we all of a sudden saw some land, we might start again in end of 2023, kicking this off again. But just trying to figure out what this is and interlacing it with the Rapid Housing Initiative, which we just took place.
Who wants to take a stab at that? Ryan?
Perhaps if we start with Ryan M. and then any others that can follow. Just want to make sure I'm following the proper protocols here. Just maybe note that there is a Building Better Futures pipeline list of projects. And what you will find is that there is a master plan to kind of estimate and to guide the projects on a year-by-year basis. So there will be, it will seem as a varied amount of releases and announcements that come each year. That's partly based on funding opportunities, so you have to follow the money and the funding. It will be based off the master plan outline and timelines in a capital budget, so those projects are known. In terms of partnership projects, those will be a little bit more varied as well. We're able to secure affordable housing. So our goal is to attempt to secure 500 affordable housing units per year to reach the 2,500 units over the 5-year timeline. And we're actively engaged to reach those projects in development, knowing there's various milestones of approvals, land sales, and construction and occupancy. So this will run on for a while. And this is why we have annual updates, provide a quick snapshot of where we're at. I'll pause there.
Yeah, no, that was awesome, Ryan. Thank you very much for that. Over to you, Chair.
Did you want to add anything to that, Ryan P? I saw you were briefly turned on.
No, thank you, Madam Chair. That's fine with me. Thank you.
One comment I'll make is that the Rapid Housing Initiative funding, we've had the first year's projects are just wrapping up now. Second year's projects, RHI2 are just starting, and the federal government did announce in their budget an extension of that program, which was really good news because it's been a really, really successful program. And I don't think we know anything more about that at this point. No. Councillor Erb?
Thank you, Chair Clark. And not a question, just a comment. There was 2 reports in the consent agenda that we approved, and this one. And I just want to acknowledge all of the hard work that staff are doing in bringing forth this these reports to us, but not simply the reports, but the new housing units that we're getting and the innovation that's taking place between the different departments of the region. And so this report that we're dealing with right now, it's another couple steps in pilot projects that we hope to move along and are going to make the other builds more successful going forward. And it's part of a learning process, just like it was on Beechwood Drive. So thanks to staff for all of the work, particularly the cross-departmental work that Matthew was referring to, that makes this work much easier. And with all of this, hopefully we're going to meet our target of 2,500 homes in 5 years and exceed that.
Thank you, Councillor. Councillor Urbanovic.
Thank you very much. And I too just wanted to compliment the staff on the work that's been done on the affordable housing file. Certainly, the federal budget last week, as you noted, Chair Clark, is certainly significant news. On the Rapid Housing Initiative, it's actually another $1.5 billion over 2 years of that funding, and then in addition to that, there was investment in the Reaching Home program, as well as and this is where we don't have a lot of detail yet, is on the whole housing accelerator, but that is anticipated to have a significant impact to try to help fast track in municipalities across the country more housing at various points on the continuum being built. And so I think, between the region and the lower tier municipalities, we're going to be very busy on this front over the next while. And if we can work to see the operating dollars coming from the provincial side, particularly for supportive housing, which is so critical, especially when we're talking the RHI kind of projects, that could really be a real game changer in terms of making a difference in our community.
Yeah, thank you, Councillor Panovich. The papers, the last couple of days, the records run a couple of pieces. I think they're part of a longer series on the encampments. And there was a kind of heartbreaking quote in yesterday's paper along the lines of people who can do something about it don't care, and people who care can't do anything about it. And I do appreciate the desperation that gives rise to a comment of that sort. But I think that what we've seen in this report and what we're seeing is that there are people who can do something and who do care, and what we're doing may not happen as quickly as anyone would like it to, but it's certainly happening. So congratulations to staff, and thank you very much. I don't see any other questions. We do have a very long 5-part recommendation here, which I won't read. However, we will now vote to approve the Building Better Futures, Creating Affordable Housing Through Surplus Regional Lands recommendations. I need a mover and a seconder. Councillor Jaworski, Councillor Armstrong, all in favor? And that's carried unanimously. Thank you. We are on to item 9.2, strategic focus, healthy, safe, and inclusive communities, Upstream Initiative Fund update. And we do have a staff presentation. And I believe this is Fazia Beg and Jenny Smith will be presenting. I see she has turned, you're both here. So whoever wants to go first, start talking.
Thank you, Chair and Councillors. I'm really happy to be here today along with Jenny to talk to you about this upstream report. So if you remember back in 2022 in the plan and budget process, Council set up a new fund called the Upstream Fund. And at that time, Council asked staff to develop a terms of reference for the fund to bring back to Council. So the report in front of you is a first step in that road. It recommends a community-centered approach to developing a full terms of reference that builds on the work already started as part of the Community Safety Wellbeing Plan framework. It also recommends 5 main principles to guide the fund development. In addition, the report explores the concept of upstream. So the concept of upstream is very broad and can include a variety of initiatives focused on achieving optimal health and well-being, and is on a continuum really of approaches that includes midstream and downstream. So with that, upstream can and does include a broad range of initiatives and programs, and really the concept has evolved over time. One of the most commonly known definitions of upstream is from the National Collaborating Center for Determinants of Health, and it's defined as upstream interventions and strategies focus on improving fundamental social and economic structures in order to decrease barriers and improve supports that allow people to achieve their full health potential. So these interventions that can be upstream can include many of the social determinants of health, which are the social and economic factors that influence people's health and include education, income and environment, food security, housing, and employment. So I thought it was just useful to kind of talk about some of these concepts before moving on to the 5 principles that we laid out in this report. And I'm going to turn it over to Jenny Smith, Director of Corporate Strategy and Performance, to talk more about those principles.
Thanks ever so much, Fazia, and also to Chair and councillors. I'm going to quickly run through, at a very high level, the 5 principles that are outlined in your report, but also give you a bit of a heads up in terms of some of the next steps on our journey to create this fund. So the first principle is really to ground this work in the Community Safety and Wellbeing Plan. That was a significant conversation about what makes a safe and well community. And Upstream was very much at the heart of that work, as well as community-led change and initiatives. This serves as a really useful platform and policy framework to guide this work. And I think one of the most one of the most helpful features of it is that it's very flexible, and there's room to grow as more voices come to the table around this work. The second is around we should be using this as an opportunity to fuel community-led change. We heard loud and clear and have heard it lots of times that community organizations do critical work in this space. They're closest to community and they need more support. And this will really fuel big systems change and change that we all want to see. So let's work together on that. The third is around exploring and testing models for participatory governance. And basically all that means is finding new ways to bring community voices to the decision-making table about how the fund functions, how it's built, but also how the decisions are made and how the funding is allocated. The fourth is around building community capacity, collaboration, and knowledge mobilization. This is a really important opportunity for us to learn differently, to work together and collaborate, and try and build structures that are less competitive and more based around trust and learning. And then the final one is around building strategic alignment. So the region has a number of kind of funding pots or opportunities. Some are around discretionary grant funding. We have the equity investments as well. This is quite confusing for community as well as other stakeholders at times. So how do we use this as an opportunity to really review how they all fit together? What do they all do? What's different about them? And how can people access them if indeed they can? And make it a lot clearer for folks. So there's an awful lot of things for us to consider on this journey. But some of the next steps that we're actually hoping to do are around building kind of undertaking a best practice or promising practice scan of models that exist out there already that we can actually learn from and use in this space. And we're also looking to do some open conversations and community engagement to make sure that the fund is accessible, it's relatable, it's relevant, and that it's actually going to do the things that we all need it to do. So there'll be some community engagement there. And we're hoping to come back by the end of Q2 with concrete terms of reference so that we can actually start to get moving on this. So today before you, you've got two main recommendations. The first is to endorse the principles. And the second is really to give us that space to go and do the community engagement that we need to do to bring this back and ready to launch. So that's the presentation over, and I'd love to hand it back so that we can answer any questions that you have or hear your words of wisdom. Thank you.
Thanks, Jenny and Fazia. Are there any questions? Councillor Galloway?
Thank you, Madam Chair. First of all, I'm really pleased with this report. And in many respects, I really believe that the way staff have dealt in this report with the social determinants of health, the root causes, and those things are clearly what I had in mind when this particular fund was proposed and supported by council. So I really want to give kudos to Fazia and Jenny and others who collaborated on this report. A couple of thoughts, however. The one concern, if any, I have with the report is that it seems to position the community well-being and safety plan as the kind of cornerstone to determining what this money is going to be allocated to. And I certainly don't disagree at all that the community well-being and safety plan should inform in a large way what the terms of reference and the eligibility requirements for this fund should be. But I'm just a little concerned that it doesn't seem to leave open other kinds of things that I don't even imagine at this point in time, but that the public consultation process may well uncover and ask us to consider as being part of the eligibility, the criteria for applying for these funds, and the evaluation process that they'll no doubt need to be. So that's the one concern I have. The other one is, let's allow staff to respond to that first. The other two things I have to say are not quite related.
Who would like to address that?
Through you, Chair, I can start, and Jenny, if you want to jump in, absolutely. So I think that anchoring this work into the community safety wellbeing plan is not meant to be restricting or restrictive in any way. It's actually just meant to be a way to kind of launch the work and find a framework in which that there are actionable ways to move forward. Because again, when you think about upstream as a concept and how broad it can be and all the things that it can and does include, moving that forward in terms of a funding opportunity becomes very broad as well. And so the community safety wellbeing plan was meant to be an anchor, but not meant to be restrictive and not meant to be a way of closing out opportunities, but really a way of growing and opening doors for opportunities.
Yeah, I'm glad for that response, Fawzia. Yeah, I don't know what the community is going to come up with in terms of after the community engagement process, but I don't want to necessarily close the door on any other possibilities that might not fit neatly into the community well-being and safety plan, if you know what I mean.
Very few things fit neatly, sorry. Yeah, I understand.
Okay. The second question I had was, in the public engagement process that we're now going to engage in to develop this fund, more specifically, do we know what stakeholder groups yet are going to be invited to the table, in addition to, of course, the surveys and the wide open public engagement that we're likely going to undertake? And I guess maybe specifically the one of the big issues in our community, of course, is drug addiction, and whether or not we're going to have frontline representation in those stakeholder groups.
Yeah, I can start again and then respond to that. So the engagement plan is still in its early stages of being developed. Absolutely, we hear the need and completely agree with the need to engage diverse stakeholders, including mental health frontline workers. And really, when we think about the social determinants of health and all of the sectors and people that work in those areas of housing and income, food security, healthcare definitely could be and would be considered as stakeholders, as well as the priority groups that we've been building relationships throughout vaccine rollout and the community safety wellbeing plan, I think would all be considered stakeholders as part of this consultation process. But that engagement framework is still being developed and happy to incorporate feedback. And I'll ask Jenny if she has some thoughts as well.
Thank you. Yeah, I think that was a perfect answer. And the only thing that I would add is that this isn't the only time that we can engage around what's supported and what's important. This is supposed to be an ongoing dialogue. It's not necessarily going to be a one intake kind of scenario. We want to explore the flexibility to invite new voices to the table because we won't get it all right first off.
Okay, that's great. I'm glad to hear that. And the third thing it's related, but not so directly. Members of council will remember that in January of 2021, when we were doing the 2021 budget, there was a motion passed that the region undertake a public consultation process to determine how a conversation on upstream could take place in the community. It had some specific references to a few different things that should be discussed. $250,000 was approved to fund that. Along the way, the community wellbeing and safety plan kind of took precedence over that, and I understand why. And we used some of the money that was set aside for the January 2021 motion to fund the community wellbeing and safety plan. And at the time, we were told that the consultation process that was anticipated in the January motion would be put on hold subject to concluding the community well-being and safety plan. And I'm still getting people wondering, when are we going to do what we said we were going to do in January of 2021? And so I'm wondering whether or not there's an opportunity here. I'm not saying I want to write this off the books, but a lot of water has gone under the bridge, so to speak, since that time, and we're moving on in some very, very positive ways in terms of our upstream work. The new Justice Center, this particular fund, and a number of other initiatives. So I'm wondering what can we do with that motion that is still on the books from January 2021 to fold it into this effort, somehow or another deal with it in some particular manner. And I know that I talked to you about that last week, and you may or may not have an answer for me at this time.
Thank you. I'll start, and I'll share some points on reflection related to this, and again, pass it over to Jenny for some additional thoughts. So as you mentioned, some of the dollars set aside from the January 2021 motion was put towards community conversations that happened during the Community Safety Wellbeing Plan initiative. And that really served as an open platform to kind of explore what makes a safe and well community. And at the heart of that was a conversation about upstream and the growing need for community-led action. So there was a lot of discussion in those conversations about needing to work along that continuum, and definitely focusing on more upstream, or, as community refers and others refer to as root causes as well. And a lot of that has been incorporated into some of the actions and areas to grow within the Community Safety Wellbeing Plan framework. That being said, I think what's important here is that these conversations aren't over. So there continue to be and will be more conversations to engage community and more voices as well, and invite them to the table to kind of grow that knowledge. And the upstream initiative work and the upstream strategy will continue to be, part of those conversations and have opportunities to inform this work. So I feel like in that way, there's definitely work through the Community Safety Wellbeing Plan that has contributed to this area, and there's still opportunity to continue to look at it from that 2021 motion that the council had put forward.
Yeah, I don't disagree, Fazia. I'm kind of looking for some kind of closure to that particular motion. I'm not saying it's been completed, but I think you understand what I'm trying to say. I don't know if it takes a staff report or an act of council or just what to bring that to a conclusion, or to, if not a conclusion, some kind of direction. Anyway,
Yes.
If there's no definitive answer to that today, that's fine. But I kind of would like to see staff, wrap their minds around that and come back to us in the near future, at least, so we can put that motion either into some kind of direction or fold it into something else, or somehow or another bring it to closure. Because right now it's outstanding, and I keep getting people asking me, when are we doing that? And I don't know what to tell them.
Jenny, excuse me, Jenny, did you want to speak?
Yes, through the chair to the councillor. I think we'll definitely take that away, and we'll be coming back. There is certainly alignment with the work that we've already undertaken, and I think where we're going next. So it does seem a logical fit. So we'll certainly be back. Thank you.
Okay, thank you.
Councillor Urbaniak.
Thanks, Chair Clark, and Fazia and Jenny. Thanks for a great report. As someone who's been working on this since I first started on city council many years ago, and we were developing a safe city strategy at the city of Kitchener at the time, and work at FCM that was grounded in many of these kinds of upstream investments and philosophies. I have to say this really excites me to know we're embarking in the next steps of this journey for our collective work. I have two quick questions. One of the things as we engage in this community dialogue and engagement around sort of building out the details, often there's some confusion around upstream investment. There's those who believe upstream investment is purely focused on people primarily, at a young age and avoid them going down a negative path going forward. There's others who would argue that in fact upstream investments, yes, have to focus on that, and that's our primary focus. But the second group is actually on making those investments that once people have been in the system, that we actually don't see them back in the system, and the kinds of supports that we need to see exist, and maybe they're midstream instead of upstream. But the point being that in many ways, those are also incredibly important, because those are folks who have, proven to have vulnerabilities, and if we now have the opportunity to get them on a better path in terms of social determinants of health and so on, that would be a good thing. And so I'm wondering, as you embark on this going forward, is it our plan and our vision, at least from a consultation point of view, that we're exploring both of those areas?
Thank you for that question, Councillor Urbanovic, and through you to the chair. I think that, we've thought about this too, and especially when we have thought about upstream as a concept. And really, when you think about a continuum, everything becomes relative to it, right? So there's always something downstream to it, there's always something upstream to it. I think from our perspective, again, we go back to the principles that we're not looking to limit possibilities through this work. We are looking to grow and understand what's needed. And I think what's interesting about something that may be considered midstream or more downstream is that the opportunity to learn through those experiences can actually then inform things that are further upstream. So in this way, it's really all connected in a lot of ways, and it's focusing on what are the parts of that downstream outcome that actually have more upstream implications, and learning and growing that some more. So I think absolutely that is a possibility.
Awesome. That's certainly great to hear, because I think it is important that it at least become part of the community consultation, and let's hear what we hear from our range of partners on this stuff. The second piece really has to do, as you start thinking about ultimately what the grant programs may look like and how they're going to get managed. One of the things that I know is we do have some grants that at least at the region, where ultimately it's a council decision, as opposed to and there's different schools of thought, whether it's a staff decision with a staff appeal mechanism, or whether we look at appointing a committee so that we have a bit of a more equity informed lens, doing the selection of grants going forward. I personally tend to be one of the belief that if we can depoliticize those processes, it's better. I'm not sure. I don't know if all of my colleagues necessarily agree with that or not, but at least I'd like to have that discussion, because I think depoliticizing is a good thing. Is that something you're going to explore as part of this process as well?
I'm going to start by passing it over to Jenny on this one.
Of course, and through the chair to the councillor, I think that's a really important observation. And it's something that we'd really appreciate direction from all of you on today, because I've worked in municipal government for a very long time, and I've seen kind of iterations of all the models, and it really is very dependent on upon local contexts and preferences. But there certainly are so many advantages to enabling more agile decision making, particularly when you're looking at more participatory approaches in that, with panels of residents and that kind of thing.
Well, certainly, when the time comes, and I don't know, Madam Chair, if anybody's moved the recommendation yet. If not, I'd be pleased to move it, but I would include that at the very least that be part of the direction of something for staff to look at. Ultimately, this is something that will be a decision made by the next council. But I think to have at least looked at it and considered it as part of the process, and to engage the community in the dialogue around that would be good work to be done, so that the next council that ultimately considers all of this will have the benefit of that information to make the best possible decision.
Wonderful.
So I would include that in my motion, or if that's just direction, I leave it to your discretion, Madam Chair.
I'm going to say that I think that's the direction, and I think it's in keeping with other work that we're doing in terms of our various bodies that do granting are working on the exact same thing. So to try to depoliticize it, get some more of a strategic framework around these decisions.
Great, thank you.
Councillor Galloway.
Yeah, I agree entirely. That should be certainly part of the deliberations. And I like the depoliticization of it as well. And I think as you were maybe thinking, Councillor Clark, some of our other granting agencies, although considerably different in scope, the Heritage Foundation, the Arts Fund, where there is nonetheless at least some council representation on those bodies, so that our interest to the council's interest can be served to some extent, or the council's concerned, the political acuity sometimes that can be provided by having a council member on that. So I agree entirely that we should try to have a format that is depoliticized as much as possible.
I don't see any other questions. I do appreciate the comments about the subjectivity or the vagueness of the term upstream. And I think that it is something that it's important for us to define very clearly, because upstream is in the eye of the beholder. It depends on where you're standing in the stream, for sure. And I think about our InReach program that was very celebrated as an upstream program that the Crime Prevention Council operated for a few years. And in that case, the program did work with youth who were already identified as at risk. So, it was an upstream program. It prevented youth who were at risk from, getting into more difficulty, but it certainly wasn't working, in a prenatal capacity or anything like that. All right, I have a mover, Councillor Brbanovic. Do I have a seconder, Councillor Galloway? All those in favor?
No, sorry.
And that is carried. Thank you very much. We are now on to the harm reduction program update, and Dr. Wong has a few comments to make.
Thank you, Chair Clark. So I just wanted to mention that in addition to this annual update regarding public health's harm reduction program, which staff are available to answer questions, I would like to acknowledge the direction from Council to staff to bring back a report regarding the legislative framework for drugs. We are having discussions with partners of the Waterloo Region Integrated Drugs Strategy this month, with the aim to bring back a report in May. Thank you.
I appreciate that. Thank you. Are there any questions regarding this report? All right, seeing none. This was an information item only. There are no items of information or correspondence. Is there any other business? Great, seeing none, our next meeting is May 22nd, and we will now have a motion to go into a closed session. Can I have a mover? Councillor Jaworski, Councillor Erb, all in favor? And that's carried. And now we need a motion to adjourn. Moved by Councillor Kiefer, seconded by Councillor Galloway. Please use your yes or no buttons to vote. And that is carried. And we are going to take a few minutes. 5 minutes, please. And then we will reconvene in closed. Okay. No, we're not going to do that here, are we? We're